Did you know hepatitis is about 100 times more infectious than HIV, and you still haven't gotten your vaccination in 2026? Are you serious? According to reports released by WHO, about 287 million people are living with chronic hepatitis. And guess why? This is because we pay more attention to other STIs but neglect hepatitis, which is a silent disease that slowly destroys the liver even before the symptoms shows. In this video, I will explain the different types of hepatitis, what you can actually do when you test positive, symptoms, vaccination, acute and chronic hepatitis, and most importantly, the one that is very common in our society, hepatitis B. Now let's jump in. What is hepatitis? Hepa means liver, titis means inflammation. Simply, hepatitis means inflammation of the liver. What is inflammation? Inflammation means our body's response to injury or infection. But the three major types of hepatitis are the viral hepatitis, toxic hepatitis, and autoimmune hepatitis. What is viral hepatitis? Viral hepatitis is caused by the hepatitis virus. We have hepatitis A, B, C, D, and E. D and E are not really common. Toxic hepatitis, this occurs when there's an exposure to certain chemicals such as certain medication, drugs, and alcohol. Autoimmune hepatitis, which is very rare, occurs when our body's immune system mistakenly attacks our liver cells. How does this virus spread? Different hepatitis virus spread in different ways. It could be through bodily fluids such as our blood, semen, vaginal fluid, saliva, and it can also be contracted through unprotected sex, tearing sharp objects, mother to child, and hepatitis A and E usually spreads through contaminated water and food. Let's talk about mechanism, what happens inside our body. So the hepatitis B virus enters our body. The virus moves straight to the liver, where it attacks the liver cells known as hepatocytes. The major damage happens when the immune system attacks the infected liver cells while trying to attack the virus. Over time, this repeated attack causes liver failure, liver cirrhosis, scar tissue formation, and even liver cancer when it becomes chronic. If you're very close to medical practitioners or you've been to a lab before, you would hear them talk about viral load. But what is viral load? Viral load simply means the amount of hepatitis virus in the blood. A high viral load simply means the virus is actively multiplying, the infection is more active, there is a higher risk of damage and transmission, and a low or undetectable viral load simply means the virus is under control. Doctors use this viral load test to monitor treatment, assess disease progression, determine infection severity. Hepatitis can be very sneaky. Some people have no symptoms for years, while others have symptoms immediately. Now, when symptoms appear, they include fatigue, fever, nausea, loss of appetite, weakness, diarrhea, and pain in the upper right abdomen. As liver damage worsens, symptoms may include yellow eyes or jaundice, dark urine, pale stool, itchy skin, confusion or drowsiness. You may be wondering why so many people get symptoms while others do not get, and that is where acute and chronic hepatitis B comes in. Acute hepatitis B lasts less than 6 months, which means in many adults the immune system can clear the virus completely within the 6 months. Chronic hepatitis lasts more than 6 months. This happens when the immune system cannot completely remove the virus. Chronic hepatitis may last a lifetime and can lead to complications such as liver cirrhosis, hepatocellular carcinoma, which is a very deadly cancer, and it can also lead to liver failure. I know what's maybe going through your head. Does this disease have a cure? Well, the answer depends on the type. Hepatitis A often resolves on its own. Hepatitis B currently has the complete cure. Oh yes, for most people, but treatment can suppress the virus and reduce the risk of liver damage. Hepatitis C can now be cured with direct acting antiviral drugs. Well, researchers are still working towards, finding a functional cure for hepatitis. And that is why you need to stay safe. That is why you need to get vaccinated as soon as possible. The best way to prevent hepatitis B is through vaccination. The hepatitis B vaccine is usually given 2 doses or 3 to 4 doses over several months. The vaccine is strongly recommended for newborn babies, healthcare workers, people with multiple sexual partners. Let me repeat that again. People with multiple sexual partners, don't sleep on this one, don't play with it. People exposed to blood products, travelers to high risk regions. What do you do when you test positive to hepatitis B virus? Do not panic. See a healthcare provider. Run proper liver function and viral load test. Avoid alcohol and substances that stress your liver. Take medications exactly as prescribed. Get regular monitoring. Many people with hepatitis B obviously live long when properly managed. Early detection matters in this case. Hepatitis is not just ordinary liver inflammation. It is a global health problem that can silently progress into liver cirrhosis, liver failure, and liver cancer. Awareness, vaccination, early testing, and proper treatment can save lives. I hope you all learned something from this video. And please don't forget to get vaccinated today or anytime, but make sure you get vaccinated. See you in the next one.